Meanwhile, we're learning the Trump administration has purchased tens of millions more doses of the Pfizer vaccine that will be delivered over the next several months. With more vaccines on the way, the nation's death toll is still climbing rapidly. Yesterday, more than 3,400 deaths were reported. That is the second highest number of daily deaths since the start of this pandemic. Mola Lenghi reports on how hospitals are handling the surge in patients.
If you have travel plans right now, cancel those travel plans.
As New York Mayor Bill de Blasio pleaded with New Yorkers to stay home for Christmas.
Stay away from me.
Tensions boiled over in California over masking up during the holiday season.
300,000 people are dead!
Former Growing Pains star Kirk Cameron hosted a controversial mask-optional protest against the state's stay-at-home orders, with more than 100 people singing carols at a Los Angeles area mall.
There is immunity in community.
Southern California is no stranger to resistance to COVID restrictions. The LA County Sheriff's Office says it has made at least 235 arrests, busting underground parties in December alone. And Southern California is suffering from the fallout. ICUs across the region are at capacity, with hospitals scrambling for extra space. The University of California Irvine Medical Center is one of 3 facilities in Orange County building new mobile field hospitals to handle an influx of COVID patients.
We're exhausted. We're holding on.
Brad Spellberg is Chief Medical Officer at the LA County USC Medical Center.
What is the worst case scenario here?
Our fear is we end up looking like New York did, in April, when you are just systematically, completely overwhelmed.
It's like a bomb has been dropped on our home.
Teresa Perazzi knows the emotional toll COVID can take on a family all too well. Her 85-year-old parents, Jerry and Shirley, have been married for 57 years. They were both hospitalized with COVID this month, just days apart.
As I'm waving to my dad goodbye in the ambulance, I'm thinking this might be the last time I see him.
The Department of Health and Human Services has announced a new deal with the pharmaceutical giant Pfizer to secure 100 million additional doses of COVID vaccine. That's in addition to the 100 million Pfizer has already agreed to, plus the batch coming from Moderna, bringing the country closer to its ultimate goal of vaccinating all Americans. Anne-Marie.
All right, Mola, thank you so much. So we're joined now by Dr. Neeta Ogden to bring us up to date on all of this latest coronavirus news and sort of dig into what we have learned. So, watching Mola's package, we can see that California hospitals are facing a dire situation. In fact, there are some nurses in Orange County that are scheduled to picket, and one of their concerns, one of the things that they're protesting is the nurse-to-patient ratio. Can you talk to me a little bit about how the nurse-to-patient ratio has an impact on the well-being of staff and their ability to care for patients?
Well, good morning, Anne-Marie. And I think this really highlights a dire situation in California and, could happen in the rest of the country. Basically, this nurse-to-patient ratio is 6-to-1. We're talking about emergency rooms that have maybe 11 beds, but they're seeing 30 to 40 patients. And that diminished nurse-to-patient ratio just means that they're entirely too stretched. It's physically unsustainable. And it really speaks to these nurses working double-time shifts, not even having PPE. At this point, they're worried about their own health, the safety of their own lives, getting sick. These nurses really can't take it much more in the sense that they're seeing too many patients. They're running around in hallways, seeing people, actually die before their eyes. They're really crying out for help. And I know in California, the governor has even sought help from foreign countries, foreign doctors, and they've been held up by, visas and other restrictions that are in place largely because of the pandemic. So it's a really stressful situation, and it speaks to the overwhelming need for us to start controlling these numbers in this surge all across the country.
Man, when I hear you talking, Doctor, I'm just thinking about Mola's package and all those people gathering together, singing of all things without masks on. It just gives me the chills. So this week, we've been following developments out of the UK about this variant of the virus. And there's been a lot of talk about whether, flights should be stopped or not. But now we're also learning that there's sort of a new variant that's coming out of South Africa that has at least been identified in South Africa. What do we know about this variant, and is there cause for concern?
Yeah, so the variant in South Africa is actually, it's not the same as what we're seeing out of the UK, but it's similar. And again, what we mostly know at this point is that it's leading to a massive resurgence of COVID in that area. The other similarity is that we're mostly seeing it in younger people. Now, it's still not clear why that is. It could be, again, because of the sort of behavior that younger people tend towards. They're still going out and socializing, or it could be something else. I mean, frankly, we just don't know enough about this, so it still remains to be seen what the significance is of this variant. But it is, drawing a lot of international attention in both countries, and I think that's really important that we continue to monitor these genetic changes in the virus so that we can deal with them more effectively, and really just continue to get the word out that what we know works. What weapons work against the coronavirus spread are social distancing, masks, and really taking those steps as much as we can.
Pfizer says that its vaccine works against multiple variants of the virus, and I presume there was an expectation that there would be variants emerging, and I'm hoping that they planned for that. The company is now conducting tests, though, to see if its shots work against the mutation detected in the UK. When are we likely to see results from those? And can you just explain to viewers why Pfizer and there have been other healthcare professionals can be so confident about how the vaccine would work on multiple variants? I have a doctor friend of mine, and I said this earlier, that tried to explain the concept to me. And she said, imagine if you were reading a sentence, but a couple of the letters were different in some of the words. You would still understand what the sentence means. It's sort of saying that, the vaccine can still identify the virus, even though there might be some changes. But I don't know if you would agree with that analogy, but, help us understand how there can be such confidence in a vaccine even as the virus continues to change.
Yeah, I think there's two things at play here with the mRNA vaccines. And number one, your doctor friend is right. The vaccines are targeting not just one piece of the virus or of the spike protein. There are a number of things, a number of proteins that are involved there. And that leads to sort of that protection, that even if there are certain mutations in that spike protein, well, we've got coverage of others. And, in some scenarios, it still does a very good job of dealing with this variant. It's still the 95%. In other scenarios, maybe it's less effective, but we still don't see that severity of infection because we still see the immune system acting and getting into place and creating, getting its many arms ready, the T cells and the B cells and the memory. So there are a lot of things in play here that can still lead to adequate immunity. The other thing that's great about the mRNA vaccines, the way that it's described by the Moderna and Pfizer scientists, is that, we really see this as a vaccine where we're giving the immune system sort of a recipe. And that when we see variants, which are actually expected and are common in vaccine research, we can now sort of edit the text of that recipe and essentially basically swap the strain. We've created this vehicle that brings the mRNA to the immune system where we can, swap that strain to match the variant. The CEO of Moderna, I believe, was saying, or Pfizer was saying, that this could take just 6 weeks. So it is something that they're really looking at. They're looking at the blood samples of people who received the vaccine as well and seeing how well they're doing against this new variant, how well those antibodies will respond to the new variant. And they say that kind of data will be available within 2 weeks. There's always the regulatory lag as well. But I think it's very encouraging to know that this kind of novel vaccine will be something that we can adapt very quickly to these kinds of variants.
That's good news. Of course, we are continuing to learn more and more about the virus and its impact on different groups. There's a new study that found that pregnant women in their third trimester are unlikely to pass COVID-19 onto their baby in utero. What are the implications of this study? This seems like, at least for a lot of people who are expecting, it's going to allow them to breathe a little bit of a sigh of relief.
Definitely. I thought this was so reassuring. It was a study done by the NIH of 120 pregnant women in Boston hospitals in the spring of 2020. And they found that 64 women who tested positive for COVID-19, none of their newborns tested positive for the virus. So again, yeah, it's very reassuring. It still remains to see what the data is on the first and second trimester. But we do think that this is good news. But they also looked at the umbilical blood umbilical cord blood samples of those pregnant women, and they found that they had low levels of COVID-19 antibodies. So the transmission of the antibodies themselves might be not as, they may not transmit as well as we thought. So that's a piece of research that needs to continue to be done and elucidated. But this is a step in the right direction, is sort of seeing how the virus affects pregnant women, especially in the third trimester.
So as we talk about the vaccine, people are still obviously getting the virus, and the numbers are continuing to be staggering. The health department announced today that it is partnering with the Department of Defense and Merck to support the development and manufacturing of an investigational therapeutic. What do you know about this treatment and how it works?
So this therapeutic MK7110 is something that's really aiming at treating the sickest of patients, those people who are hospitalized, requiring supplemental oxygen or high flow oxygen, or are requiring mechanical ventilation. A study, a phase 3 study, showed that in these patients there were 60% recovery rates, a 50% reduction in respiratory failure. So it's really looking at that scariest outcome of COVID-19, and it's targeting something called the innate immune response, which many people think drive that very, very severe, kind of COVID reaction that we see with pneumonia, and that leads to higher morbidity and mortality. Operation Warp Speed and the government are partnering with Merck so that we can start developing and getting this treatment out, and that sort of reduces that fear factor of that worst case scenario in COVID-19 patients.
That's nice. It's good to get, a wee bit of good news amidst a lot of, very sort of concerning news. Dr. Neeta Ogden, thank you very much. I hope you have happy holidays over the next few days.
You too. Thank you for having me.